Welcome this afternoon to our panel of physicians. We're excited. This is Sunday afternoon. Everybody's been on a high for the whole week. We've heard some wonderful things, and we're going to have contributions from our panel of physicians to answer a few questions that we've developed. I'm first going to just let the physicians say their name and their specialty.
My name is Jim Kwako. I'm a family physician from Santa Barbara.
My name is Rajiv Parti, and I'm by training an anesthesiologist.
I'm Mary Neal, and I am a spine surgeon.
I'm Rebecca Valla, and I'm a psychiatrist.
So as you can see, we have a nice diversity of skills, from the bones to the head and putting you to sleep. So we have a couple of questions that have come, and we'd like the physicians to answer them in their own way. One of the questions is, what's the most significant change in your practice from the knowledge of the NDE or your actual NDE?
Well, in Santa Barbara, we were very fortunate to have Barbara Bartolome start our near-death study group chapter approximately 3 years ago. And since that time, we've met once a month. She's brought great speakers in, many of whom she gets from these conferences. And since that time, I was aware of the continuity of life, but not to the same degree. And I had some of my own experiences, but didn't understand the full impact of them as much. And since my involvement deeper in this, I have made more of a point of paying attention to any mention of a lost relative, a parent, a child, a spouse, and often I will insert, as quick as the time goes, how are things going? Is that taken care of? Have you had any contact with that person since they passed? And usually I, say it very gently and give them a chance to realize it might not fit. And almost every time there's interest. People want to know. I wish I had more time to discuss it further. And as a result of that, we've been led to many interesting discussions. Many interesting stories have come up. I didn't realize how much is going on. And some people need confirmation. Some people are appreciative of either resources or other things. I recall one person whose father was dying, and I pointed out a book and talked about a few of the stories within it, John Lerma's book about pre-death experiences, PDEs. And he took that and read it, and he said his father passed within a few weeks, and he came back afterwards, and he said, Jim, that just made all the difference in the world to me, because I saw him looking up at the corner and I knew what he was looking at. He was looking at something special that was present with him, and I reassured him and I comforted him, and I don't know exactly what took place there, but I know he felt better about his interaction with his dad. He felt more comfortable. Well, he wasn't a professional handling what was happening, but that's how it works as we share our stories, and that's how it's improved my practice.
As I mentioned, by training, I'm an anesthesiologist. I was chief of anesthesia at Bakersfield Heart Hospital, where I specialize in giving anesthesia for heart surgeries. My NDE, which happened about 3.5 years ago, December of 2010, changed everything for me. How I practice medicine, my own personal values, and even how I treated patients, and not only how I treated patients, but what modalities I recommended. Like previous to my NDE, money was very important for me. I used to be actually a pediatrician, but as a pediatrician, I was hardly making any money. It's the lowest paying specialty in the United States. I even went and did another residency to become an anesthesiologist, so I could literally make double the money with half the work. And I had come to the United States in 1982 with only $500 in the pocket. So from there to making a lot of money was important for me. But after my NDE, that thing just fell off. Money was no more important for me. to serve and share became my motto, my guiding principle. And how I treated patients changed a lot too. I had a huge pain management practice too. In that pain management practice, I still remember a 70-year-old lady came to me for back pain and arthritis. I just wrote her prescription for methadone, I think, and walked away. And she actually wanted to talk to me because her husband was dying of cancer, but I didn't have time. I wanted to go to the next patient. But now, if the patient comes to me, I give them time. I touch their hands, push my hand on the shoulder to make them feel like human beings, like they are wanted, they are cared for, they are loved for. And then also the way I practice medicine changed. For example, a patient would come to me for back pain. Previously, I would give them a muscle relaxant. I would give them a non-steroidal anti-inflammatory like Motrin and give them Vicodin for severe pain. And slowly they get addicted to Vicodin. But now, when they come to me, the first thing I try is massage, yoga, hot and cold compresses, so the patients are not put on prescription medications, which are actually a bigger problem in the United States than illegal drug. So it has really changed me in every aspect.
Thank you.
I would agree that it changes every aspect of your life, as many of you know. And so it cannot help but change medical practice. And I would say that it's changed my practice in a couple of ways, one of which is that I absolutely know that there is a plan for each person that's one of hope. And as a result, when I see patients who have had a devastating accident or injury, I look at it very differently. I don't look at it as a life-changing, terrible thing. I look at it as an opportunity for change and an opportunity for growth. And because I so firmly believe that and know that, I'm able to present it in that way to my patients. And I think because I truly believe that whatever is happening really is an opportunity for growth, patients respond to that. And I have seen many, many patients now over the years who really would look back, and I get letters, many letters every year from patients looking back and saying, thank you, I am so happy that I was hit by that car, or I'm so happy, I am so grateful that, that crane fell on my head. I mean, things that of course you would think, oh my gosh, really? But these are people, I practice in Wyoming, and this is these are guys, for example, and many of these people have barely finished high school, and they've worked on the oil rigs their entire lives, or they've been ranchers their whole lives. And when an injury occurs, they are devastated. They have no other skills. And by working with them to see it as an opportunity, I have had many patients who have gone on to do things they never would have dreamed. One guy became an artist, which is not something that a rancher in Wyoming would think about doing. People go on to try very different things. And I think that that is something I would not have done in the past. I also think that I listen differently because, as you said, I know that every interaction is an opportunity to reflect God's love for them. And because of that, medicine is secondary. I mean, I would not say that I was ever in it for the money. But at the same time, I think that the way I treat people is different in that I'm not even in it for the medicine anymore. It's not, that really is a secondary effect. It's really listening to patients as a human being and trying to be of service to them in whatever way I'm able to. And I would say that those are the biggest changes in my practice.
Well, I'm not an experiencer. However, I've been an enthusiast of near-death experience literature and stories, and I would say Edgar Cayce readings probably got me started, and then of course the Ray Moody book, and someone tipped me off to reading Brian Weiss and his work in terms of past life regression, and I kind of am off and running as far as bringing reincarnation, everyone's life having a purpose, helping people to understand that they have to be in the center of their lives. Their lives are up to them. That a relief of suffering is a pathway towards joy and happiness, and that our early life experience propels us towards wanting to relieve suffering and toward getting closer and closer to being the heroes and heroines of our own lives. I use my own example of my own self, having had a very difficult childhood, a lot of early suffering, and knowing that God was always with me, and that my suffering was something that was a pathway for myself. And it takes a lifetime to do inner child work. It's not a one-time proposition. And as we go forward in life, we have more and more experiences that the universe brings to us so that we find it more and more necessary to do the work. It's the work we came here to do. And because I have that own personal experience, I recognize so quickly in other people their suffering, their story, their process, and I find, again, it's not so much my training as a psychiatrist. I'm in outpatient practice. People come to me, they want to be given medicine, they want to feel better. I understand that, and I try to meet them where they are, and I would say that my biggest challenge is in translation, in trying to translate what I perceive, what I believe to be true, what I've experienced in my own life, but translate it into a language that they can understand wherever they are, walking the dance, not wanting to be judgmental, not wanting to shame them, not wanting to push them too hard, but also trying to hold them accountable. That their life story is their story, that the growth path is their choice, that there are so many ways in which we are all helped. It's like as though we have a cheering section behind us in terms of on the other side, and we have a cheering section with us at all times, within us and without us. And people tell me they're alone. I say, no, you're not alone. You've never been alone. None of us has ever been alone. It just feels that way. And it's also a leftover from being a child and feeling misunderstood, feeling alone, feeling unsafe. So it's your inner child that needs you to love, to nurture, to come to her or his rescue and be the trusted authority, the parent figure, which is a very hard concept for people to grasp. How can I parent myself? Especially when I wasn't well parented, who's going to teach me how? And in fact, they know how. They just haven't given themselves permission to go forward with it. So anyway, yes, I guess I would echo that this changes everything. It changes everything. And I feel sometimes that I'm more a metaphysician than a physician. And that's heady, and it feels like a tremendous responsibility. But I also, one of the things I do is I feel like I have a role as a networker for people. I'm a kind of a source point for them. So I refer people to energy workers, body workers, hypnotherapy, past life regression therapy, massage, acupuncture, goes on in trying to help them to find that there are resources out there for them. And in fact, all they need really, it's like asking the universe, please help me, and there's help immediately. It's right there. Thanks.
Although this is the physicians' panel, this one question I'm going to also answer, because my practice as I grew up, like many of the physicians, we were never taught anything about how to deal with dying people. You just did the best you could. And over years of my work with the NDEs and understanding this, many, many opportunities have come to me. And in the end of my practice as a military officer, I really trusted my intuitive ability of how to handle them. And so I would do things, and now picture this in the military, I would do things like tell young nurses and doctors and interns, we're going to talk and talk to the ceiling and talk to the person. They are on life support. They are not necessarily in their body. So just say what you're going to say, and let's help release them from this body. And of course, you can imagine the looks I got about that. And things like would come to me. I had one day the chief of psychiatry, and obviously most of my job was supposed to be administrative and in charge of all the nurses and other healthcare providers. I had the chief of pediatrics come and give me parents and said to these parents, she will help you. And I said, well, what's the problem? Oh, their baby died today at the commissary. And then he just walked out. And, well, you can imagine what I felt. I ended up spending that whole day, and I wouldn't have done this before probably. I went to the morgue, I got the baby, I wrapped the baby up, I brought the baby to the parents, I let the mother, they had never even let the parents see the baby and say goodbye to the baby. And so we spent quite a bit of time with the mother bonding and saying goodbye and doing all those kinds of things. And having people, I actually had 5 nurses on a ward come down and ask me if I could please come up on this particular ward, and this is an old German hospital, because they had ghosts up there, and would I be able to do something about that? And I said, well, who is it? And they said, oh, we know who it is. It's Lena Ladd. She's been here for 4 months. She just died last week. And so I went upstairs. There were a couple of interns there. There were a couple nurses. And I said, well, obviously Lena is stuck, and we need to help her leave. It's time for her to leave. And so I said, come with me. We go down to her room, because there had been an elderly Korean man in the room, and she had been giving him advice to get out of the room. He didn't even speak English, but she was giving him advice, and he was petrified. And so we went down. I opened the window. I said some kind of a thing like, Lena, it's time, you're okay, we're okay, it's time for you to leave, and just follow the stars, and I don't remember what else I said. I'm sure the 2 interns were looking like, oh, right, okay. The nurses were okay with it. But many things happened like that, and so my practice was very different. I talked to the people in the room that weren't in the room. I made nurses and doctors listen to be very careful what you say about people, even though they may be unconscious. And when we were preparing for a ground war, I set up classes for the 1,000 healthcare providers that we were all going to learn about near-death experiences, because I could do that because I was in charge. And and I thought that might help them. And so lots of things in this journey to help people practice differently and do those kinds of things. So it was fun to do some of the things I did in the end. One of the other questions was, what does it mean to be non-judgmental? And what does it mean to you? How would you do that? In what way would you do that with your patients who are talking about NDEs or other things? Is there anything special you do to be non-judgmental? James?
Well, it's a huge issue. It's a very common statement that we make. My concern is, to a certain extent, first of all, do we mean by that not to be critical in any way? I've come to appreciate the fact that constructive criticism has a wonderful place to play in our lives, and being self-critical is necessary for self-growth. And yet there's this strong sense of forgiveness, of acceptance, of loving each of those that we come in contact with. I guess one of the ways that I practice this most of all, being non-judgmental, is encouraging people to be aware of what's going on with themselves. I think to a certain degree to have some remorse or some guilt about what happens is healthy. I think we're addressing the excessive use of that. I remember a fellow who was working at a retreat center where I was, and he would come in as a consultant, and he would give his talk, and then he would pass out buttons that said not guilty. Everybody got a button that said not guilty, to be sure they weren't overdoing this whole reaction we have, which unfortunately was promoted by some of our churches and other elements of society of being overly critical of what's taking place. What I've gathered is that we need to not condemn. We need to not put the thumb down and then leave it there, and continue to look for ways that we can lift up the spirit. The beginning of every day, I set aside time to meditate, to center myself, and then I think about some of the main patients that are in trouble, and I do an individual little counseling session, send them some love, and hope that opens them up in some way or another. There's so many ways we can use this. At times, I have patients who are real concerned about their spouse, and I try to point out what they might be learning from it, and of course getting professional help to talk these things through. But the element of not being judgmental obviously means forgiving quickly, as deeply as we can. It doesn't mean forgetting what's going on. It doesn't mean suspending our ability to learn from taking place. It doesn't mean just putting it off to the side and having a cheerful attitude about it. It means penetrating the love as deep as we can go with it, calling forth with it. The challenge is the next opportunity to grow, and the extent to which we can call forth the memory of being forgiven, I think, helps us proceed further.
Yeah. You know, as I said, you know, by training I'm an anesthesiologist, and my hospital had a prison contract. And I had to practice non-judgmental behavior when the prisoners came. And you will be surprised, prisoners do have morals too. They have different rules. For example, it's okay to be a murderer, you know, you're not harassed. But if a prisoner they come to know is a child abuser, they really get their head smashed. I used to get so often people with broken jaws, broken cheeks and everything. And when I used to hear about that I have to give anesthesia, I used to feel like, oh, maybe I should knock some brains, give him less oxygen, but I never did it. I never did it, but judgmentally, I did have that urge, you know.
Hopefully that changed.
Yeah. But after ND, even that judge urge also went away, because he is also a child of God. And his circumstances, I don't know what the circumstances brought him here. So I got to do the best I can and practice unconditional love and do the best professional job I can. That urge also disappeared. And other thing was, she mentioned, was how we treat patients with NDE. Actually, 10 years ago, I was in a surgery where it is known as hypothermic cardiac arrest, where the patient is literally frozen for an hour. There's no blood going to the brain, there's no blood going to the heart. By all definitions, the patient is kind of dead because head is frozen in ice. And that patient, when he woke up, was describing me a typical NDE, you know, like what was going on in the operating room, where the surgeons were, and what were they talking about. And when I heard about it, I thought, you know, he had no blood going for 1 hour. Maybe or some air went in and he's hallucinating. And I was so mean that time, I feel, that I gave him a shot of Haldol, which is an antipsychotic medicine, to calm him down. But now I didn't have anybody after my NDE who described an NDE, but if somebody was going to come to me or I hear from my colleagues, it would be a totally different story. And it's one of my passions is to educate my colleagues that this is an actual phenomena. It's not just all cuckoo. Yeah.
We're all nuts. I would say with regard to how my experience changed my judgment of other people, it changed it quite profoundly because I absolutely experienced the knowledge that God loves each and every one of us intensely. And even the people I don't like are loved as intensely as God loves me. And that was interesting because for me, it entirely changed the way I interacted with people. Whether it's patients, colleagues, people on the street, and that's not to say that I don't have my same preconceptions. And for example, let me look around, see if anyone has big piercings. I mean, piercings are just something that bug me. Like people who have a bunch of facial piercings, I'm not going to pretend like I don't still respond to that. My immediate response to that is still, ew, I don't like it. And what I subsequently trained myself to do after this NDE was to have an immediate second response, which is to acknowledge how I'm feeling, because I think it's dishonest to think that you don't have those preconceptions. But I think it's this immediate second response of, well, okay, I'm feeling that way, but let me look more closely. Let me try to see this person and treat this person and interact with this person as God does, and recognize that God loves that person. I also would say that I absolutely realize that each person is not only loved by God, but has a plan and has work to do on this earth. And I don't know what their job is. For all I know, their job is to be a pain in my neck. And so what I found after my NDE is that my perception and my interaction with people who are really nasty people totally changed. I accept them entirely as they are, which isn't to say that I like the way they are, but it's accepting their behavior, and it doesn't bother me because I don't know what their journey is. I don't know their purpose for being here. I don't know their purpose for being a part of my life. And so I was able to very quickly in those situations eliminate any sense of judgment. And I think that that's one of the powerful things NDEs do for people, is to give you the recognition that we're all in it together. And we are all loved, and it allows me to be very comfortable living in this gray zone. I can't explain everything, I don't know everything, and I'm okay with that, which is very difficult. I mean, I'm a very organized, goal-driven, type A scientist. And to say that I'm okay with recognizing that I don't really know how much works is difficult. But I think that that's where I am, and I think judgment is part of that. Because I think that when you absolutely accept that there is a much bigger plan that isn't in your control, it becomes much easier to just accept. Accept people, accept events, and not feel like you are in a position of being able to judge. But I do think it's important to recognize your immediate response. I think I've talked to many people who feel guilty. They want to be non-judgmental. They want to express unconditional love. And they feel guilty when they meet someone and they go, I really hate that person. Well, I think that's unrealistic to think that you're not going to have emotional responses. I mean, we don't like everyone. That's just the way it is. But I really think that the beauty of an NDE, and I think the challenge for most people, is to then have that follow-up response of saying, well, okay, I don't like this person, but I know God loves them. And so I am going to see in them, even if it's just one little part of them, I'm going to find something that I like. And what's remarkable to me is if you do that, if you just pick out the smallest of things, the color of their shirt, if you just pick out one thing that you find attractive or appealing or nice, it totally changes your interaction. And I found that in my medical practice, the same is true. I mean, people are people. And I have people come into my office that perhaps are irritating. But it's the same thing. I recognize my response to them, and I try to say, no, let me look at this person the way God would see them, and let me find something about them that I like. And it changes everything. So I think that answers the question.
Thank you. Well, there are two things that are repeated at all the NDE conferences. One is that we are all one, and another is that only love is real. And I am so grateful to be a psychiatrist because for me, this gives me an opportunity every single day, every single patient, to try to make that operative. I am one with whoever comes to my office. And if I can love them and let them feel loved, that will benefit me as well as benefit them. So all of this is in my best good, and it's in their best good. So that's my goal, that's my wish on my best days. And I also have to give myself a lot of leeway that I'm not always at my best. And even though I'm constantly talking to people about what's in their highest and best good, it's like my mantra, I don't always listen to myself and know clearly what's in my highest and best good every single moment. One of the things that I bring to my work is that I have a great deal of compassion. I'm sure that's why I ended up in medicine anyway. And I allow myself to cry with my patients. I allow them to feel the humanity that we share, and that life is difficult. It's difficult for everyone. And no one has all beautiful life and everything is easy, and that's not what is meant to be here in this lifetime. So I cry with my patients. People will spontaneously tell me they love me, and I will tell them I love them. You know, this isn't anything that we're trained to do, certainly not in psychiatry residence. But now that I've been at my work for 25, 30 years, I don't feel like I have to explain myself to any psychiatric board or licensing agency. I'm well trained. I know what the state of medicine and psychiatry is these days, and I don't mind bringing an expanded consciousness to that training. So I give myself permission.
And I might add, that is why when you go and you seek medical care, you want to go to someone who is in their late 40s, 50s, 60s. Yeah. You don't want to go to someone who's early on, because it takes a long time to change.
Quickly, what's been, for those of you who are experiencers and have decided to talk about it in your practices. What's been your colleagues' reaction, or do you not talk about it in your practice, and how has that all worked for you? I'll start with you, Mary.
I would say that for the most part, it's just this elephant in the room. My colleagues don't particularly acknowledge it, and I don't particularly discuss it. I mean, if they do mention it, they say, oh, that book thing. I mean, it's...
They recognize that you're different from before your experience.
I would have no idea.
Yeah.
I actually have no idea if they would recognize a difference or not, because it really is just not discussed. And I might say that that's, I think, probably common not just for physicians, probably more so for physicians, but I think that it's probably not uncommon for any NDE-er. You just don't really talk about it. The nurses will talk about it with me. And if a patient has some experience and they mention something when they're in the recovery room, for example, they will tell me about it. But it's always sort of hush-hush.
Ravi?
Yeah, I second Mary. You know, it's more like hush-hush. We hardly talk about it. But when I had my experience and talked to my colleagues, they were very skeptical. But when they started seeing changes in me, like I had a fancy for sports cars, I had a Hummer, and when my lease expired, instead of getting another sports car, I got a Toyota hybrid. So they saw my life figuratively and literally go from a Hummer to a hybrid. I sold my 11,000 square foot house, moved to a modest house. So after seeing these changes in me and how I behaved with my colleagues and my patients, they started thinking, oh, there must be something which really happened that changed him. But usually it is not discussed. Yeah. Okay.
I'm not an experiencer of near-death experiencer. However, I've had several other experiences, nighttime experiences, that have verified to me the continuity of life. There's a close similarity, actually, between what happens at night with many of us. But nonetheless, in terms of colleagues, had an interesting experience with our county medical society. We had an interesting article come out about faith and belief, and the person quoted some Bible quotes and made some other references. It wasn't narrow-minded, it was quite open. So I submitted an article talking about near-death experience as a possible follow-up to this, and it wasn't picked up. Nonetheless, I think every effort we make extends the interest. We had Dr. Alexander in Santa Barbara, and as a result of that, I identified at least 3 other physicians I didn't know were interested in these things. They attended that. They're reading the books. Some of them are very interested, and we don't know. The wonderful thing about IANDS and Mary and Evan and many of the others who are courageous enough to expose themselves to media and the wide variety of approaches is that it's giving courage to people to speak up about their experiences. It's giving physicians courage to pay attention to the experiences they've already heard. You can't be a physician very long and not hear experiences. And what this does is open the door to pay attention to them, to take them in, to make sense out of them. I know when I read Evan's book, in it, near the end, he talks about sharing his experience with an esteemed colleague. And while he's talking, his view goes off, and he's like he's not paying attention, and finally he comes back after Evan's done, and he says, well, what do you think about what I just told you? He said, for the first time I understand what happened to my dad when he was dying. I was there when he was dying, and he started talking to somebody. And I'm sure it was my mother, but I had no context for it. I didn't know where to place it. But now hearing your story, where two or more are gathered together in my name, something happens. And that's what's taking place. I'm quite optimistic. I'm quite aware of the fact that there's still huge amounts of skepticism. And yet every story, every effort we make helps erode that a bit further. As much as involved in it as I am, to hear the various stories, something else is going deeper and penetrates further. So I know our efforts are making a difference. In medicine, now, if you haven't heard, there's a new specialty, integral medicine, integrative medicine. It is now recognized in medicine as one of the specialties. You have to go to a residency program. This particular group of people are following up from what used to be called holistic, and then alternative, and then complementary, and now it's integrative, and it's a specialty. This group is interested in a wide range of activities, not only acupuncture and herbology and homeopathy, but also the mind-body connection, the spirit-mind-body connection. My family practice journalists are talking about doing spiritual assessments. They're not talking too much about how to integrate the discussion or near-death experience. I haven't seen that in there yet. It's around the corner. I'm sure it is.
Along that line, yesterday, Chris Copes made a statement that we needed to bring heaven to earth, and that generated a lot of conversation. How do you think we do that from a professional practice point of view?
You want to start? You start. It's a wonderful concept, and it's a great idea. And I think it's the highest that we experience that we are meant to bring to life. And I can remember an experience I had a long time ago where it's a nighttime and I woke up and all I remembered was being out in space, and I saw a light, and then I saw it open up. And out of that light came the most gorgeous geometric figures I had ever seen. For a mind involved in medicine and science, I guess maybe that might make sense, but it was just so extraordinary compared to anything else. And I have continued to feed off that for a long time. I think we have these different experiences in a wide variety of ways. And how to translate that into a practical change of life is the real goal and the real task. And I guess what it comes down to for me is to recognize that heaven is within all of us. That's what the great teacher said. It's there, it's present. How do you define that? To me, the practical definition is recognizing that there's a potential for love, for strength, for wisdom, for compassion. It's there, and as we look for ways to extend it further and express it further, it comes alive. If we start every day with opening it up and just looking for how we can make our life 5% better this day, 5% more enthusiasm, 5% more creative involvement with the routine, 5% better effort to make my family life work better. I think along those practical lines, we can bring heaven to earth.
Yeah. My message, what I got from a near-death experience, I have a personal mantra: forgive, love, and heal. And this forgiveness starts with our own self, to forgive your own self for something you may have done, and then equally forgive others. And there are different ways of forgiving. Forgiving does not mean condoning somebody's action. Forgiving does not mean that you let them off the hook, but it is for your own sake. You're letting go of the stress or the emotions associated with it. And for forgiveness, I have a nightly ritual. Like I do 3 things at night. First of all, I forgive anybody who may have harmed me, I'm upset at. Then I ask for forgiveness from people I may have harmed. And the third, equally important, is to forgive your own self for anything you may have done wrong. And then the next part of my mantra comes is love. And love, I'm talking about unconditional love, taking care of a fellow human being, taking care of the animals, taking care of the earth. And one kind of love I want to popularize is a Sanskrit word seva, which is unconditional love, service with gratitude. And I'll give you an example. One, I was in 1982 gone to Munich to give my exam to come to United States from India. And I was watching this show on the street, and I lost my passport and my ticket. A person walked by, and I said, "Are you an Indian?" This was my first time out of India. He said, "No, I'm a Pakistani." And the moment I heard he's a Pakistani, I stepped back, because we and Pakistan were one country one time, but we have fought 3 wars because of religion. And I grew up hating Pakistanis because of my father was tortured when he came from Pakistan to India. But that guy was so nice that I had no choice but to tell him what my situation was. And then he took me to his home, gave me food, gave me shelter. Next day took day off, showed me Munich. I still remember the old Olympics stadium. And what this guy did was pure seva. He was not expecting anything in return. This is the unconditional love of care I'm talking about. And can you imagine if the doctors, especially the politicians, adapt this attitude of seva, of service, the world will change. And next comes healing. And the healing also I talk about at 4 levels: physical, mental, social or heart, and spiritual. And this healing at the level of the heart is very important. I have found out in my practice, and there have been a lot of studies, patients who are loved, who are taken care of, or who have been prayed for, even when they don't know they have been prayed for, go home much, much earlier. And then comes spiritual wellness. With spiritual wellness, I talk about being connected to somebody, something higher than your own self, something more than your own ego. For me, it is God. But if somebody who does not believe in God, it could be prevention of abuse to children, taking care of the earth. Something higher than your own self brings contentment and satisfaction. So I would say in the end, forgive easily, love passionately, and heal quickly.
Well, I would agree with everything that's been said. I think the way to bring heaven to earth is to show love. And let every moment of your life reflect God's love. And if you do that and strive for that, then everything else falls into place. I think one of the things, though, that we all who have a sense of our responsibility in the world have to do is to try to increase the dialogue, because it's one thing to express love, and I absolutely think that's the most critical, but beyond that, it's expressing more than that and getting people to think about more than that, because just experiencing love can take people down a road of self-absorption, really. And I think that one of the problems in our culture today is really the sense that I'm a good person, and so I don't really need to be a spiritual person. I don't need to think about it. And in fact, people don't think about it. It's just apathy. And I think that one of the things that we all have the responsibility of doing is trying to make people think. And it doesn't even matter what their conclusion is. That's not our job. But I do think that we each have the responsibility of prodding people, of poking them, and saying, think about your spiritual life. Don't just be apathetic. And I think as physicians, one of the ways we can do that is to try to incorporate spiritual histories into hospitals, into our own practices, not because we even care about the answers. I mean, I think about my own intake forms, and when people come in and they have whatever, they have leg pain, I have a whole series of questions I ask about the effective position and activity. And I know that most of the people aren't going to be able to answer those questions, but I ask the questions because the next time they come in and they say, well, you know, I was thinking about those questions you asked, and here are my answers. And I think a spiritual history is the same thing. It's a matter of asking people about their faith practices or asking people about what gives them hope. And they may not have the answers. And the questions may seem very foreign to them, but it will make them go home and think about it. And I think that we can't miss any opportunity to prod them, us. I mean, it's a continual questioning about what is your spiritual life? Have you given it any thought? Because I think that that's really on equal footing with showing love to people in terms of truly bringing heaven to earth and truly changing our culture and our planet.
Well, I think about the words of Jesus telling us that we love one another as I have loved you, and telling us that we should love our neighbor as ourselves. To me, this is what it is to bring heaven to earth. We can't love other people until we love ourselves. I spend a lot of time in my work trying to educate people about how self-love is not the same as being selfish. And understanding the concept that if they don't love themselves, how are they going to be giving love to others? We cannot give what we don't have. So I think, again, the love is the answer, as we know. However, loving other people takes some focus. It takes self-development. It takes some integration and maturity. And I happen to believe that psychological development and spiritual development cannot be separated. They go together. They're inextricably linked. So, to me, the answer is love, and yet it's not a concept that's way out here and very abstract. It's day to day. We do have a problem with dialogue. We have a tremendous problem. We live in a 3D world, and we need to reach for the 5D. In our world that we see, the commercial world, the material world, polarity is everywhere. It's, you know, good, bad, you know, evil, good, or war, peace, or, you know, anything you want to think about. There's polarity. And we take that for granted. That's just how it is. And there's competitiveness everywhere. Well, competitiveness is another example. I get ahead. I don't have to think about the fact that you're not getting ahead. It's just a very self-absorbed kind of concept. Capitalism, unfettered, is about that. So we need to move to a 5D consciousness where there's no room for polarity. There's no room for competition. We're working all together. So, yes, it's one thing to talk about it, and it's another thing to put it into action. But that's an everyday thing. It takes hard work. It takes focus. I love it when there's a discussion going on and it starts getting to be a we, they. This happened in our workshop the first day that I was here. The first workshop I went to on Thursday. In fact, I think I contributed to that polarity by some of the things that I was saying. And someone raised up and said, no, we can't do that. We can't polarize this discussion. We have to be inclusive. Those are some thoughts.
One of the questions that one of the audience had asked was, what effects did ether have on deliveries and newborns years back when ether was used? And I'd like to extend that to what effects of current medication are they having on people who have NDEs and are medicated so they don't remember them Or what are your thoughts on the whole idea? We'll start with you, Ravi, since you're the people who give most medications.
Yeah. That is so true. You know, my last name is Parti, and early in the morning when I used to say my patients and say, "Hi, my name is Dr. Parti," they used to think I have given that name to myself because I was going to give them morphine, nitrous, laughing gas. So she is right that I give a lot of medications. So I never practiced anesthesia using ether, but I have used anesthesia gases which are very similar to ether, and the gases have the effect on the mother and the child. And the mother becomes very sluggish, she forgets, she gets amnesia, and the child, when the baby is born, is also sluggish and has respiratory depression, which can cause problems, and we have to bag him, give him oxygen, we have to help him breathe, him or her breathe. And so my practice was not to give any gases, but if they needed a C-section or for pain, to give an epidural. So the mother's cognition was totally intact. Because what I felt, the initial bonding between a baby and the mother is very important. I remember, like one of my favorite jobs used to be when in the C-section, when the baby was born, after the nurse has washed the baby, to put the baby on mother's chest. And how the mother looks at it, looks at the toes, looks at the fingers, they all are there. And that bonding, the baby is looking at the mother and the mother is looking at the baby. I think that bonding is very important. So the use of anesthesia gases and ether or other gases nowadays should be discouraged to help with this bonding and also not to have effect on the child. And for NDE I think I'm not a psychiatrist, but they see more patients with NDE, and they are being mislabeled as that they're suffering from psychosis or schizophrenia, and they get prescribed over medications. Thank you.
We'll let Rebecca speak to that also, because we are seeing a lot of patients who have been, especially in the VA, who have been labeled bipolar and put on several medications when they simply tried to explain to somebody they had a near-death experience.
I'm going to make a comment also, though, because I think that being given medications does not negate someone's remembrance of their near-death experience. I think it gives a handy excuse to the physicians and the patient for the near-death experience. But I've certainly had patients who, because they know about my experience, they have felt free to tell me about their experience, even though they had a general anesthetic. They had plenty of the medications that we use, the happy medication I always want the anesthesiologist to use more of so they don't remember anything. But despite that, patients do come back talking about their near-death experiences. And so I don't think that the medications make people forget about them. I think the medications are just a handy excuse for people to then say, oh, well, it was just the drugs. Because it's not always the physician, it's the patient too. And with that, we'll hear from you.
Well, what I would have to say would be more directly related to Diane's comment about psychiatrists giving medications to people who have near-death experience or other visions and things of that kind. This is obviously a huge problem, and it's not something that is going to get resolved at the level of psychiatry residency or something like that. There has to be something done quickly, soon, about this problem. Now, the quickest way I can think of to start this is that hospitals have patient advocates. I don't know if the VA does, but I believe yes, every hospital should have a patient advocate. So if someone like myself or a mental health person with credibility in their hospital could get a hold of the patient advocate and talk about this concern that there's too much medication being given to people who report having religious experiences whether it's a near-death experience as defined clearly or something a little bit more vague, then that could be something that could be a protocol for every hospital, just like every hospital has a institutional review board that governs what are the rules and regulations around research with human subjects. There could be something like that with the patient advocate of every hospital. I don't know exactly where we would start with that. It might have to be state by state or something like that. But I would think nurses would know better how to access that, protocol for patient advocates than doctors even. I'm not sure how much it differs from hospital to hospital. The rule of thumb these days is that if you have a relative who goes to the hospital for any reason, they need to be accompanied by a family member. I cannot stress that to you enough. And I don't think it matters whether they're in a trauma situation like an ICU or whether they're in a psychiatric ward. Somebody needs to know what's being done, why is it being done. They need to have access to someone who can answer their questions. And they can't, the days of somehow just trusting that the whole system is going to work out fine, those days are long gone. So I guess those are my thoughts at the moment.
Thank you. We have a couple of minutes left, and some of the physicians wanted to ask other physicians a question. So I'm going to let that happen for a minute. James?
Yes, I'm interested in asking Mary a question. In your book, From Heaven to Earth, it was especially poignant to me, the reference to when you were speaking to a special being of light who described the spirit of humanity as one great tapestry, and that each of us are a thread within that tapestry. And we get concerned with how that thread works and how that thread gets frazzled and razzled and frayed. And so my question was, what suggestion do you have for what we do to repair that or be sure that we follow our plan, or if we've been off our plan, how we get back on that plan? I suspect that's how the beauty of our individual fiber of our soul fits into the larger plan. So.
Do we have an hour? That was one of my analogies in terms of this tapestry of life, and I think that the goal really is being in constant prayer, constant communication, constant meditation, whatever word you want to put on it. But I think that we each need to constantly be questioning, are we at this moment in time doing exactly what we believe God wants us to do? And if the answer is no, then we better be thinking about what it is we should be doing. And if the answer is yes, then you continue on. And I think that the analogy of the entire world being like a tapestry and we're just a little thread, for me, I think refers not so much to the idea that we are following God's plan for our life, but it really has more to do with this recognition that we are part of this incredibly beautiful tapestry. And I may be, today I am a green thread, and I may not like checkered threads. But the fact is, the checkered thread that's next to me is something that is part, again, of this incredibly beautiful and complex tapestry. And without the green thread or without the checkered thread, the tapestry would not be as beautiful and it would not be complete. And in thinking about it that way, it again goes back to this idea of really non-judgmentally loving other people, because you have to recognize, I don't like the check, but the check is part of God's beautiful plan. And the recognition of that allows me to love that checkered thread. And so the analogy of the tapestry really has to do more with that.
Do any of the other, Rebecca, did you have Mary? Well, we're have a couple minutes left. Paul, we could answer a couple of questions from the audience, if you'd like.
This is on. We had a couple of online streaming questions I'd like
to let's go with those
real
first.
Quick, because they were submitted actually a while ago. And one was directed to Mary, and another one kind of generally to the group. So the general one to the group was, how has your faith changed as you've gone through your experience and after your experiences in general? And in particular, to Dr. Neal, was how was brought in by somebody who had lost their own son in a similar manner, and there was a premonition, and the question was, do premonitions always have to come true? I got the sense that she was trying to think of something she could have done to prevent her son's death.
I absolutely believe that there's a plan for each one of our lives, which is one that is different than predestiny. It's more like an outline, and we fill in the blanks. And I absolutely believe that my son, for example, was probably given a little extra time, but regardless, it was part of the plan for his life and our lives that he was going to die on that day. And my son absolutely knew that he was leaving. And in fact, I knew for 10 years that he would be leaving. And I've been asked, well, wow, didn't you just want to keep him in a bubble in the house? Well, no, because God's plan is one of beauty and hope. And there is nothing I could have done to change the plan for his life. And I have talked to many, many, many parents who have lost children, and the vast majority of them would also say that their child, through their words, their actions, their writings, knew that they were leaving. And I think that to assume that I as an individual, or the person who submitted the question as an individual, has the ability, the responsibility, or the need to change a plan that has been created by the divine is very, really, it's very egocentric. It goes back to the New Age concept that I control my world, that I can become God, that I am God and God is me. And that is absolutely not the way it worked with my experience, at least. And so I don't think that she could have prevented him from dying if that was part of the plan for her child's life. And I don't remember the first question.
Other question was, how has your faith changed? If you were
Right.
a Christian before, are you still a Christian?
I would have claimed to be a Christian before, and I would absolutely say that I am a Christian now. That is not to say that that is exclusionary. I had a couple of experiences with Jesus, and there is no doubt in my mind that that was real and true. But that does not go so far as to say that it is exclusionary. Hey, I'm in the club and everyone else is out. Because in my experience, I would absolutely say that God loves every person on this planet as intensely as I know God loves me. But I would say that I lamented for really quite a long time that I lost my faith. I think there is something very powerful about the magic of having faith. And for a long time I said that while I lost my faith, I gained knowledge. And that's a different thing. And I think there is something very powerful about making the transformation from a hope or a faith to a trust based on looking at your own life, collecting the data, and making that choice. I made that choice, but much of my choice was based on knowledge. And so my faith, if you want to put it in the context of, well, gee, I hope it's all true, changed dramatically because I absolutely know it's all true. But I also believe that that transformation from a faith to a knowledge and therefore trust is a transformation that can be attained by any person if they put out the time and effort to truly look at their life, look at the presence of God's synchronous events, look at the presence of miracles, look at how they've been loved. And so for me, my faith, if you want to put it that way, changed very dramatically in the sense that it became absolute.
This question is really meant for people who've had near-death experience. They're not asking generally how our faith has affected our work. Or
I think it's how your experience, and even I think your knowledge of NDE has changed your view on faith as to whether you're religious or not, spiritual, how it's changed you.
Well, I feel like I came into this lifetime already with some certainties about God's presence. And so that just, as Mary says, when you look at the data of your own life, so when I look at the data of my life, it just gets affirmed stronger and stronger until it's so clear. It's something that doesn't require questioning. Now, I deal with a lot of people who don't have that. They don't have the assurance in themselves that God is with them, that God loves them, and that God always has, and that their life is, filled with data about that if they would look for it. So that's where the translation becomes a little bit more of the art of the work and less the science of the work. People aren't always ready to hear something that they might really need to hear, but they're not ready to hear it. And of course, that has to happen in their time, and so we have to honor that. So there's a lot of subtleties about communication when it comes to faith and God and so forth.
For me, before my NDE, I was a Hindu, but I was not a practicing Hindu. I did the rituals, everything in case there is God, so I want to keep him on my side. But since my NDE, I've become more spiritual, more believing in God, believing in inclusiveness. For example, in my NDE, I had an encounter with two angels, Raphael and Michael, and I became a believer in angels. Like right now, I'm wearing a pendant for Angel Gabriel, but Gabriel is the angel for communication and service. So it has changed me, but at the same time, it's, as Mary said, it has become more inclusive. Like even Muslims, I used to not like them before. My daughter, who is born and raised here, has a boyfriend who's from Pakistan, is a Muslim. I was very upset at her, but now my attitude has changed. Other day only I invited him for dinner, which I wouldn't have done before.
Very good.
And, just remembered a joke also. What is the difference between spirituality and religion? People who are religious are afraid of hell, and spirituality is for people who have already been to hell.
Very good. I think in terms of religion and faith, my concept of the meaning behind phrases that have been made has become much deeper. I remember an experience I had a little while back in which I woke up and remembered visiting a healing center in which everybody was working very well together. They had a wonderful attitude with which they were doing. And then I woke up and I thought, oh my gosh, I didn't want to leave. I wanted to stay there. And I had to go to the bathroom. I came back, I laid back down, and I thought, what would it be like to be back there? And I was back there. And I joined the group, and the leader of the group said, we always have room for one more. They were just about to say a prayer. And the leader of the group said, may the light from the center of all that is good shine to us and through us. And that resonated deep within me. And I use it often. I think our religions, our faiths, all embody, all started with, they all have meanings that have depth to them. There's a tendency for them to get diluted over time. If we go back with a simple, short, and sincere appeal for help, our faith comes alive. If we keep it simple and realize, part of the work is up to us and part of the work is up to the forces that want to work through us. And so I have found my faith simplified and deepened by the experiences I've had.
Very good. Paul, do we have time for?
It's 2:24. So.
Okay. Why don't we?
Do we have any other?
Yes, we have a couple of questions. Gideon and over here.
Thank you. Thank you very much, Diane. Thanks to all of you. So this is my first conference, and in the 3 days I've been here, the thing that people keep on coming back to is the transformative power of NDEs. And it seems like all of you are doing work in helping your patients realize that transformative power, which seems like very important work. The message that I'm hearing from this panel is that it's not really possible for someone to make sense of their NDE and realize that transformation unless they take on board spiritual beliefs that they may not have had before having the experience. And there's a range of beliefs from life after death. Maybe it involves reincarnation, maybe it involves pre-life planning, maybe it just involves the idea of mind and body separation. So is that what, am I hearing this accurately? Is that what you think, that unless a patient accepts some of these beliefs as literally true, then it's going to be harder for them to undergo that transformation?
The way you ask the question, it makes it sound like it's a choice. But I don't think that that's a choice. I think that in the process of having a near-death experience, the reality of existence and life after death, consciousness, whatever you want to call it, is so profoundly experienced, and the love one experiences is so profound that I don't think it's a choice of, gee, am I going to respond with a deepened sense of spirituality or not? It's like going outside and experiencing the intensity of the sunshine and feeling like, well, gee, do I have a choice of feeling warmth on my skin or not? It's not a choice. I don't think that, and so I think the question is flawed, because I don't believe that anyone who's had a near-death experience feels like they have a choice. They've experienced a reality, and their choice is how they process it.
Somebody else?
Hi, thank you for a beautiful panel. I just wanted to, I'm sorry. I wanted to say, because you spoke on judgment, and I had a real problem with that for many years. And then a spirit gave me a definition of judgment. I think it's the most beautiful I've ever heard. And it goes like this. Judgment is observation without love. It changed my life. And then my question is, meditation. How important is meditation to all of you, and are you frequent and regular with it?
Shall I? meditation is very important to me personally. Actually, I talk about 3 things or 4 things, for transformation. One is prayer, meditation, then service and practice of unconditional love. And I do meditate twice a day regularly. And the way I look at it is, prayer is when you talk to God, and meditation is when God talks to you.
I meditate regularly. I found it very helpful. It's a continual process of learning and growing. I'm just going to share a brief prayer, if I can, that I brought that I thought you might be interesting. It's helped me center and focus myself. It goes like this. It's from Alice Bailey. I am a messenger of light. I am a pilgrim on the way of love. I do not walk alone, but know myself to be one with all great souls, and one with them in service. Their strength is mine, my strength is theirs. And this I freely give. A soul I walk on earth, I represent the one. To me that says what we're doing here.
Yeah.
Thank you.
Well, maybe I shouldn't admit this. I have tried meditating many times and failed every time. I'm just too distracted. I'm either fall asleep or daydream or something. So I admire anyone who can set aside time to meditate. I think it's fantastic. Or set aside time for prayer. And I absolutely love the concept that prayer is talking to God and meditating is listening. That will inspire me to again try. But regardless, I would say that although I have not been successful at dedicating bits of time, partly because on any given day I don't really know what the day is going to bring, I will say that throughout every day, part of me is always in meditation. And I absolutely believe that meditation, or whatever other word you want to put on it, really is listening. And part of me throughout every day is in constant back and forth, prayer and meditation, because I am constantly asking, praying, giving gratitude, and simultaneously constantly trying to listen. And so I think that listening is really important. Whether you can do it in an organized way, which is, I mean, I'm envious. I've been envious for years, but whether you can do it in an organized way or whether it's more like I do or whatever works for you, I think that it really is. It is prayer and meditation in whatever form.
I think I'm more like Mary than I am like anybody else on this panel. I have done meditation in a very intentional way. I took some training in a meditation called Merkaba, which is a sacred geometry meditation, and it's ritualized. And I did that every day for 5 or more years, I would say. I reached a point where I felt that it was too ritualized for me. And it's more important to me to feel, as the Bible talks about, in a state of constant prayer. I feel that is more my form of meditation. I check in with my higher self consciously and intentionally many times throughout the day. But I think you answered a question this morning after your talk about how you were using your hand, and you said, it's like up here all the time. There is this other sort of an observing, tuned in antenna or something of that kind. That's what I experience.
I also think, though, that part of being open all day, and even though you both said you have set aside time, I'm going to guess that throughout the day you're still in meditation. But I think the trick is to do things that remind you all day long. And whether it's, playing, when I bike into work, I'm listening to contemporary Christian music, because you know, songs come on and it may trigger something. Or I, you know, have, whether it's things on your desk, things on your wall, little email apps that send you some message for the day. I mean, those are all things I think that throughout the day continually remind you to listen, continually remind you to check in and say, okay, where am I at this very minute? One of the things I read many years ago, and I've adopted it, and I've now taken it on for myself, is whenever I'm walking and I find coins, I always pick it up. And I use that, and of course on the coins it says, "In God we trust," and I use that as a moment in time to say, well, do I? At this very moment in time, is my trust in God? And if I can say yes, then I keep it. And if I say no, I make myself think a little bit longer. But I think that you have to have strategies because our world is so busy. I mean, it's the emails, the phone, the people, everyone wants something of you all day long. And our world is so distracted that I think that if you don't take focus time in the morning or in the evening, I think you do have to create strategies for yourself to keep grabbing those moments of time.
Well, thank you. That's all the time we have today. I want to thank James and Ravi and Mary and Rebecca for their time and insights and their contributions to all of us. Thank you very much.